Good afternoon. Welcome to our Tuesday update on COVID-19 in Erie County. We have a lot of information to share, so we'll get right into it. And I do want to thank Kendra Schmidt from Deaf Access Services for being here today to provide the American Sign Language. And of course, you'll hear from Dr. Burstein very soon. First off, as of March 21st, there are 70,074 unique COVID-19 cases that have been confirmed in Erie County, 2,105 of them total cases in the last 7 days. There are 229 total new cases per 100,000 residents for the past 7 days. I'm going to go into this a little bit more as to why we're not talking about positivity rate. And hospitalizations on March 21st, 148 people were hospitalized in Western New York hospitals for COVID-19, 34 of them in the ICU. 132 patients of those were in Erie County hospitals, of which 30 were in the ICU. That was an uptick for both. 13 on an airway assist. Unfortunately, one died on March 21st, and 50% of the patients were age 64 and under. Looking at the hospitalization chart, you can see the last 2 weeks. You'll see the uptick from March the 20th to 21st, and the increase of actually 12 new cases, as well as the increase of cases in the ICU. This is still lower than where we were, of course, substantially lower than where we were in December and January, but we seem to have plateaued over the last 2 weeks. We're not seeing a continual drop in cases, and we want to see a continual drop in cases. And the other thing to remember is people are dying from COVID-19 every day in our community. And as you can see on the yellow goldish line on the bottom, there's an average of at least one individual to two some days over the last 2 weeks that have died in hospitals from COVID-19. Now, confirmed cases the past 6 weeks. For most of this time, we were getting accurate numbers with regards to the total number of individuals that were getting tested and the positives associated with it. So we'd get the negatives and the positives. Unfortunately, as it appears in the last month, we've not received any more of the negative reports from New York State with regards to pool testing that's being done on SUNY campuses. So that includes the University of Buffalo, Buffalo State, and SUNY Erie, because there's pool testing going on at each. We think it actually is having an impact that in some weeks we're not receiving the results of up to 10,000 tests. So what we've done is to have a better description of what's actually going on in the community. Instead of doing a positivity rate on a daily or a weekly basis, we're going to be doing it on an analysis based on total new cases in the past 7 days per 100,000 residents, which is also a standard the CDC uses in determining an area of high transmission. And as you will see, just overall, we had an increase of 450 new cases from the week before. So the week ending March 20th to the week ending from March 13th, there was an increase of 450 cases, roughly a third, and we saw a corresponding increase in the total new cases in the past 7 days per 100,000 residents from 169 to about 218. Now, the CDC looks at anything in a 7-day period of 100 or above as being a high risk of transmission in the community, so we are still in the very high risk transmission numbers. But unfortunately, because we do know we're not getting from New York State, we don't know why, New York State is not providing it to us, but we're not getting the negatives. We don't know how many tests are actually being performed at the pool sites. We do know the positives because we get those, but so we've decided to make the change. If you have questions with regards to positivity rates on a daily basis or a 7-day basis, I suggest you go to the New York State site, which was always a little off than ours because their timing was different than ours, but they're going to give you the best numbers with regards to positivity rates, and we'll give you the actual numbers as it pertains to total number of positive cases and how that pertains to the 7-day average per 100,000 residents. So, as you will note, we actually have had an increase in number of diagnostic tests that were performed minus the SUNY pool testing. 48,250 tests were performed in the last week. One of the reasons we had an increase in overall cases is because not only did we have a number of specimens increase, but we also, as a percentage of the population, know that there were more people who were testing positive. So we have seen an increase in the number of tests, which is a good thing. We want to get as many people tested as possible to determine what the transmission rate is in the greater community. So now we're going to look at the zip code chart, but as it examines the cases per 100,000 persons in the past 7 days. As I noted, anything over 100 for a 7-day period is considered high risk of transmission. And I looked at the entire chart. Every zip code in Erie County was listed as a high risk of transmission because everything was over 100. And the highest was actually North Collins, which was in the 500s. But you will note that there are some areas that are worse than others. Even though Amherst-Williamsville Clarence 14221 has the highest number of raw cases last week, its case transmission rate per 100,000 population is lower than other parts of our community, like West Seneca, like Orchard Park, like Lancaster, Lackawanna had some very high transmission rates. So we want the public to understand that COVID-19 is still in our community. There are still people getting sick. If you go by the CDC's high risk of transmission, either 100 cases over a 1-week period or 200 in a 2-week period, we're still pretty high. And this is concerning because we continue to see a reduction in the number of positive cases as well as transmission per 100,000 residents until this past week, in which it increased. So that is concerning and is something that we just got to remind everybody, we are not out of the woods yet. I know everybody wants to act like the pandemic is over, but we are not over the pandemic. And we need to continue to doing our best until everyone is vaccinated. Mortality data, we've had since the beginning of the year 442 people who've died from COVID-19 in Erie County. The number in March is only 39. That's good. We are continuing to see a drop in the number of deaths, and a lot of this has to do with the vaccination of our most at-risk population, those that are seniors in nursing homes, those that have comorbidities. So we are happy to see the drop in the overall death rate, but we are still seeing people die. And the age died. And we just want people to understand that COVID's still out there. You can still get sick. As I said, I've known, last week I announced I knew a couple people who were sick, and they were sick from COVID. They just didn't catch it, and they were asymptomatic. They had symptoms. They were not doing well for a few days. It seems like they've recovered, so good for them. But just for people to understand, it is still out there, and unfortunately, individuals are still dying in our community, thankfully, not at the same rate they were before. Now, I'm going to go into a few things, including vaccine allocation. Erie County was advised we're getting a base allocation of 4,310 vaccine doses from New York State for the next week. 800 of those are Moderna doses. 3,510 of those are Pfizer. You don't see Johnson & Johnson. Johnson & Johnson is not being distributed to Erie County. In my discussion with other county executives, very few of them are hearing of the Johnson & Johnson being distributed. There seems to be a slowdown, of course, in the distribution of that. So no Johnson & Johnson, no first dose vaccines coming into Erie County in the next week. And this morning, we were advised that 1,500 doses left over from the nursing home program that were going unused but sitting in a local pharmacy chains. Freezers will be provided to Erie County, and we'll be increasing our vaccine pods, our point of distribution clinics in the upcoming week to allocate those 1,500 doses. So in total, as of right now, Erie County will be getting 5,810 vaccine doses in the upcoming week, and our goal is to, those are first doses, not second doses, and our goal will be to get all of those into the arms of everybody by the end of the week after we've received them, I should say. Vaccine sites, we have 3 permanent clinics, point of distribution clinics at SUNY Erie North, SUNY Erie South, and of course the Key Bank Center. We are also doing one-day pop-up clinics at various locations to be determined across Erie County. These are all by appointment only, and I can definitively say that Erie County will be using a new online and phone appointment system starting April 5th. The goal was to have it ready by St. Patrick's Day. It wasn't ready by St. Patrick's Day. It should be completed in theory by the end of this month, but we're going to take a few days to test it, make certain it's fine, and then have it online on April 5th. So more information will come, but on April 5th, people will not only be able to use the new online appointment system, but also the phone system, because we know not everybody has the ability to access the internet, or if they even can access the internet, utilize the system. So you'll be hearing more about that next week. And I want to thank the locations that have hosted pop-up clinics for us, including Elam Christian Fellowship Church. Thank you, Bishop Bronner and your team, for opening up your doors. Had a great clinic there last week. People Inc. has been opening up their doors to help us with individuals that have developmental disabilities, whether they're in a congregate or home setting. So thank you to People Inc. for opening up your doors, as well as to the towns of Cheektowaga, Concord, and Hamburg for opening up the doors of your senior centers. I really do appreciate it. So thank you to Supervisors Benchkowski, Drake, and Shaw for opening up your doors at your senior centers and allowing us to vaccinate thousands of our county residents in a location that they trust, a place that they know, whether it's a house of worship or it's a senior center, or in People Inc., a location that they often will go to for day services. New York State vaccine sites. All vaccine sites are open to individuals 50 and older, but eligibility does not mean availability. As we've talked about, the numbers unfortunately have not increased as the eligibility has increased. Pharmacies now may vaccinate any individual who's 50 and older, individuals with comorbidities, and school staff. So if you're a teacher, if you're a guidance counselor, if you're a lunch lady, you can also get vaccinated at pharmacies, and you might have a better chance of getting a vaccine dosage because pharmacies are getting separate doses as well from the federal government as the doses they receive from New York State. So you should check with a local pharmacy that you go to. You could also contact other pharmacies to find out to be put on the list. But pharmacies are getting doses from the federal government and the state. I do know in the upcoming week, there's not many pharmacies that are getting doses from New York State. We were going to get about 10,000 doses in total for all locations from New York State, and then we found out we had the other 1,500 doses. But pharmacies aren't getting a whole lot. The federally qualified health centers are not getting a whole lot. But this is new. Some physician practices are starting to receive doses for the first time from New York State. So you should contact your doctor, contact your pharmacy, find out what, if anything, they're receiving and try to get on their lists. And as always, eligibility does not mean availability. We are theoretically still in the 1B category. If you look at the other categories that states have, some of them we'd be in the 2C category with all of the additional categories that have been thrown in by New York State. But I want to remind everybody, our goal is to get as many vaccines into the arms of our residents as quickly as possible. There's more demand than supply. And when there's more demand than supply, we know that there are people out there who still want to get vaccinated or have a tough time doing it. I just ask you once again for your patience. It is beyond our control. We cannot order vaccine from manufacturers. Manufacturers are not allowed to transfer vaccine to Erie County, to pharmacies, to federally qualified health centers, to doctors' practices. It goes to the federal government, and then the federal government makes disbursements, including to the state. So I don't have the ability to get on the phone and call Moderna, Pfizer, or Johnson & Johnson and say, I'll take more vaccine. We don't have the ability to do it. No one can. Only the federal government and the states can, based on whatever is provided by the manufacturers. So eligibility does not mean availability, and I do apologize for the delay for a lot of folks. Update on vaccinations. As of March 22nd at 11 o'clock, approximately 28% of Erie County residents, or 256,817, had received a first dose. When you back out our children, because most of them, except for 16-year-olds with the Pfizer, are not eligible, that means approximately 35%, or more than 1/3, of all adults in Erie County have received the first dose of the vaccine, and 14% have received a second dose, which is about 17.7% of all adults. And as part of that, Erie County has administered 38,200 first doses, so over 10% of all the first doses, and 23,635 second doses, so nearly 20% of all the second doses that have been administered in Erie County, or in the county, have been administered by the Erie County Department of Health. Vaccine distribution by zip code and population. Gowanda is still very low. We're trying to figure out what's going on there. We're not exactly certain that this number is accurate. This is the number we're receiving from New York State. It says only 2.9% of all Gowanda residents from the 14070 zip code have been vaccinated. We're not certain what's going on here because anecdotal evidence we have indicates it might be higher. So we're trying to look into that. We're working with our partners in Cattaraugus County. Here's something for those who don't know. Some people know that the village of Depew is in 2 towns in Erie County. The village of Depew is in the town of Cheektowaga and the town of Lancaster. But the village of Gowanda is in 2 counties. It's in Erie County and it's in Cattaraugus County. It's in the town of Collins and the town of Persia in Cattaraugus County. So there may be some issues associated with how it's being distributed based by the county. But the numbers aren't really changing much with regards to if you live in a suburb or an affluent area, you probably, as a percentage of your residents, have a much higher percentage who've received at least 1 dose of the vaccine, including 2 that have very high percentages. The city of Buffalo, 14203, which is around the medical campus. A lot of healthcare workers live there. But also Amherst-Gettsville is over 40%. East Amherst is nearly 40%. Amherst-Williamsville-Clarence, nearly 39%, and so on. The yellow indicates rural. The blue indicates urban. The green, suburban. And there's a reason why pop-up clinics are going into some of these areas. We want to be able to increase availability in some of these communities where it has been low. And we're going to continue to do that as long as we can, as long as we have vaccine doses to do pop-up clinics. Whether it's a rural area like the town of Concord or it's the city of Buffalo. We did a pop-up clinic at the town of Concord Senior Center. We did a pop-up clinic at Elam Christian Fellowship Church in the city of Buffalo because we want to have equity in vaccine distribution. We do not have equity in vaccine distribution right now based on zip code. And we're going to work harder to make sure we do have equity in distribution. And I'm going to turn it over to Doc Burstein now to talk more about New York State guidances, including the latest on schools. Let me put my mask back on. If you notice, I'm talking quiet or louder because I was told by a senior at a clinic, I can't hear you as well as some others. So I'm talking louder, so hopefully you can hear me now.
Thank you. So now I'm going to talk about how some things in our area are starting to open up through New York Forward. So first of all, I want to announce that places of public amusement as of March 26 will be open up indoors up to 25% capacity, and starting on April 9th, outdoor spaces can open up at 33% capacity of these public amusement areas. And then, of course, wedding venues, these gatherings are allowed. However, the Erie County Health Department wants to make sure that you have a safe and fun event. So please send us your plans at least 5 days in advance. And you can send it to the website, erie.gov/health/notice, event notice. And we really want to review your plans and make sure everything is okay and safe. Other New York Forward guidance on March 22nd, capacity restrictions for in-person catered events could be either 75% occupancy or without testing up to 100 people indoors or 200 people outdoors, and with testing can be up to 150 people indoors and the same outdoors. Or, so whichever is less, the 75% occupancy or these other numbers with or without testing. On April 2nd, capacity restrictions for in-person catered events will be either up to 75% occupancy and this is all outside New York City, so either 75% occupancy or with testing up to 100 people indoors or 200 people outdoors, and with testing 150 people indoors or up to 500 people outdoors. So again, it's either the 75% occupancy or these other numbers without testing or with testing. So going on to schools, I know that's a really hot topic. CDC has just revised their guidance about what they're recommending as a safe environment in the schools, giving some new data. We're waiting for New York State to revise its guidance. So far, New York State Health Department has been reviewing CDC's new guidance, and they're looking at it and see what they are going to be able to adopt to recommend for New York State schools. So remember, New York State sets the guidance for schools in New York State. So that's New York State's job, is to set guidance for schools. Erie County's role here is to conduct contact tracing, so case investigation if somebody in the school is positive, and notify people who are infected that they have to be in isolation, investigate the case, find out who the close contacts are, put them in quarantine, and that's regardless if people are 3 feet apart or 6 feet apart. The rules are the same for contact tracing. And we do not set the rules for school policies. Remember, that is left up to the state health department. So school districts, their job, they're responsible for following state guidance. And if New York State changes their school guidance, then that will be the new standard for all school districts in Erie County. But we are waiting for the state to weigh in if there are any changes. So just want to give an update of what we're seeing in the schools. So unfortunately, in the past week, we've seen an increase in the number of cases that have been reported in the schools. So this past week, ending on March 20th, there were 247 cases in the schools reported to Erie County Health Department. And so you can see that those numbers are high. They're as high as they were this winter when we were seeing really high rates throughout the community. So there is still COVID-19 in our schools. But we're seeing a little different epidemiology within the schools. So first of all, we have an epidemiology team in our office that are strictly devoted to investigating and helping to provide guidance for schools. So what we've observed is that recently that there's been quite a number of outbreaks either in classrooms or entire schools that have a 3 feet distancing between desks. And that is regardless of whether masks are being used or not. I mean, these are primarily private schools, not public schools. However, we have seen in these school situations where there's 3 feet social distancing and more of an outbreak, again, either in the classroom or throughout the school. Also, we're starting to see more students actually being infected compared to staff. Remember, in the past, I've told you that we've seen a higher proportion of staff that were infected compared to the proportion of staff that are in the schools. However, right now, I mean, it's almost all students that are being reported as positive from the schools. So it seems like we're seeing more, student-to-student transmission in the schools too, not just staff to staff. So that's very concerning. And this is definitely a trend that we saw in the fall and the winter. Youth sports are, still continue to see cases, and we are also following that with our school epidemiology team. Since February 1st, when we started tracking these youth sports, there have been 115 teams that were placed on pause because they had a positive COVID-19 case either on the team or a coach. Hockey accounted for almost half, a little more than half of these cases, 59 of the 115 teams. And then now we're starting to see more teams that are affected that are football or basketball. So we're starting to see more of those teams that are having to be put on pause. Currently today, there are 15 teams that are on pause, and actually 5 of those teams have had outbreaks within the team. So everybody on those 5 teams have been placed in quarantine. So just want to remind everybody, it's still important to get a diagnostic test to know your status for COVID-19. COVID-19, unfortunately, is still in our community. I know we all wish it was done, but it is not done. It is still here. We still have people that are sick. We still have people that are hospitalized, as the county executive showed, and we still have, unfortunately, deaths. So it's really important to know your status, whether you've been exposed and you're asymptomatic, or whether you have symptoms, or whether you just want to know your status status or your healthcare provider says, you know, you should probably just check that you have a test. You can get testing throughout Erie County. We have a lot of availability. The Erie County Health Department offers free diagnostic testing. All you need is an appointment at 858-2929. We'll test people for any reason that they want to get tested. We are offering the PCR or molecular diagnostic testing at our lab, and those test results are available in 1 to 3 business days, usually 1. We're turning them around pretty quickly. We also have the point of care or rapid testing available, and those results, of course, you'll get them on site, usually within a half an hour. So those are both good testing opportunities. Remember, we are going to continue to see community transmission spread within the community if people are walking around undiagnosed. So we have to find out who's infected so we can remove them from our community so they won't transmit to others, and find out who their close contacts are and remove them, put them in quarantine to break the chain of transmission. This is vital to our control efforts. So good news, the Erie County Health Department has opened our family planning clinic. We are open Mondays, Wednesdays, and Thursdays, and I want to stress that no one is denied any type of services based on their ability to pay. We will provide full testing, full treatment, full family planning services, and for anybody regardless of their ability to pay. So cost should not be a barrier to this type of health care. All you need is an appointment, although what we do accept walk-ins, but it'd be great if people can make an appointment. All you need to do is call 716-858-7687, and we can schedule for an appointment, no questions asked. So I am going to turn this over to our county executive to entertain questions, so thank you.
Thank you, Dr. B. And I will just note, because we've seen it again, Dr. Burstein does not have a Twitter page. The Erie County Department of Health has a Twitter page at ECDOH. Dr. Burstein doesn't. But someone keeps on faking one to make it look like it's Dr. B. If you see a Twitter page that purports to be Dr. Burstein, it is fake. It is dangerous. It is sharing false information out there. We've contacted Twitter and let them know about it, but it's still up. They're claiming it's a parody. It's not a parody when someone's sharing information that people think is real, and it's not. So I just want to put that out there once again. If you see a Twitter page purporting to be Dr. Gail Burstein, it is not. And if you notice, her name is spelled wrong. So I'll just leave it at that. So we will open it up to questions now, and we will start with WGRZ-TV, Kelly Dudzik.
Does the increase in cases concern you from week to week? I know that there were more people tested this week, and you guys are asking people to continue getting tested last week, but it seems like there was a big jump, especially when you open up the state app and look at that percentage. I know you're switching to the other way of reporting it now, but what do you think that indicates in the community? Like, why do you think that's happening? What have your contact tracers found?
Well, I'll turn it over to Dr. Burstein and talk a little bit more, but we've been under, what we're hearing from folks, a lot of them is, I don't know how I caught it, but then you talk to them and they were going around their business location without masks. They went to someone's house for a party. So we're seeing continued transmission in our community, and in some communities higher than others. But what we're hearing from a few folks are, I don't know how I caught it, until you do the contact tracing and you find out that they were not exercising the best judgment by going out and hanging out with their friends in the backyard. We've had nice weather, we're starting to see that. And just because you're outside doesn't mean you can't catch it. So I'll turn it over to Dr. B to talk a little more, but there definitely is a laxer attitude with some in the community who are pretty much done with COVID. You may be over COVID, you may be over the pandemic, but the pandemic's not over. And we need to continue to do our best. Mask up, get vaccinated. Even when you're vaccinated, you can still catch COVID and theoretically pass it on to someone else, even if you're not sick from it. So we want people to understand we're not out of the woods yet, and we are very worried that the variant that's starting to be seen elsewhere, the variants from South America, Africa or Europe could be in our community, and we know they're a much higher risk of transmission. And if so, while there may not necessarily be higher death rates associated with it, if there's more risk of transmission, more people will catch it. And that means just we could see the numbers continuing to go up. So I'm going to turn over to Dr. B to answer a little bit more about contact tracing, but it's quite apparent that we are seeing just the general transmission in our population, including with individuals who don't know where they're getting it. But when you dig down, you find out they've been around other individuals and are probably just catching it from coworkers or family or friends.
Thanks. The county executive is spot on this. We're unfortunately seeing a lot of transmission in areas where people are just not adhering to protective measures, especially masking. So we're seeing this in daycare centers where teachers are going from room to room. People aren't masking appropriately. We're seeing it in a lot of businesses. Just people in their cubicles and not wearing masks. People can be in cubicles can be pretty close together. Those cubicles can be pretty close together, and so when they're sitting in their cubicles, they remove their masks even though they're close to other people, and there's transmissions occurring. We're seeing it in businesses like restaurants among the staff and hair salons. And in addition to the increased transmission in these workplaces, we're also very concerned that people aren't adhering to our strong recommendations, first of all, to quarantine. We know that places like restaurants right now and hair salons and other types of businesses are opening up. They're really busy, and they can't, unlike earlier where restaurants only had takeout menus and businesses weren't had as much business to run. Right now, especially restaurants, they're open up, and they feel like they can't afford to keep staff out in quarantine. So we're really worried about people that have been close contacts and are not quarantining. They're not getting tested to know their status. So that's compounding the risk of transmission in our community. So again, unfortunately, COVID-19 is still here. We're making progress with getting people vaccinated, and unfortunately, we still have to keep up our guard. And masks are really powerful. They're really as powerful, or maybe even more powerful, to prevent transmission compared to a vaccine. So that's still a tool that we all have, even though not all of us can get vaccinated. Thanks.
WGRZ-TV, Olivia Proya.
Oh, it's actually Ashley. Oh,
hi.
Olivia, are you there?
Oh, yes, I am also here.
Go ahead, Olivia. And then if you don't mind, I've got a question after. Mark, it's Ashley Rowe.
Okay, Olivia, go ahead.
So, County Executive, not to make you do another switcheroo, but my question's for Dr. Burstein.
Okay, what topic is it on?
It's on second doses.
Okay,
I could go ahead and ask it if you want me to.
sure, go ahead.
So, Erie County clinics estimate that less than 10% of people who received their first dose at an Erie County clinic are not showing up for their second dose appointment. And granted, it's possible some of those individuals are given their second dose somewhere else on another day. But given the difficulty booking appointments, do you think that's possible? And what are your concerns regarding people possibly not showing up for their second dose?
Well, we haven't seen a huge drop off. I'll let the doctor talk more about it, but if you are getting the Pfizer and Moderna, you really need the second dose for full protection. I'm actually getting my second dose this Saturday. So if you receive the Pfizer and Moderna vaccine, it is not the Johnson & Johnson, which is a one-shot. You need 2 doses. And we are seeing individuals who have had their first dose who are then catching COVID-19. We have seen that. And as a result, they can't get their second dose. At least their whole regimen is thrown off. So just because you got the first dose doesn't mean you can't catch COVID-19 and you won't get sick from it. So we want people to understand, if you get your first dose, it's a Johnson, or if it's Pfizer or Moderna, get the second dose. You will not have full protection without it. And as we've seen, there are some cases where individuals have gotten the first dose and have gotten COVID-19 in between the first and the second dose.
Thank you. Again, the county executive is spot on. 2 doses are essential to get full protection with the Moderna and the Pfizer. It's really difficult to estimate exactly how many of the people that we vaccinated with their first dose don't return for their second dose. Some people tell us they're going to be away, and so they give us a call when they return, and then they get their second dose later on. Some people get their second doses other places that are more convenient to them. We get people who receive, their second dose somewhere else, and they've moved, or they had, some type of situation where they're in Erie County when it's time for their second dose, and so they may come to our clinic to receive that second dose. So it's really variable. We can't really tell. However, wherever you get your second dose for a Pfizer or Moderna, it's essential you get the second dose. I mean, first of all, you need those higher levels, that booster effect with the second dose, and also the durability. We don't know how long the vaccine will protect you if you only receive 1 dose. And it's really important to get this second dose to make sure that your antibody levels are the highest, because we need as much juice as we can get right now, protection, since we're seeing more variant strains in New York State, and also we imagine in our community. So it's really important to get that second dose wherever you can get it, if you get a Pfizer or a Moderna. And we just anecdotally, we have seen people test positive well after they've received their second dose of vaccine. However, the vaccines are working, because these few people that we've identified that have tested positive they're not ill. They may have some mild symptoms, like maybe a mild cough or just mild cold. However, they are not sick enough to go in the hospital at all. So that shows that right now, when people are compliant with getting their second dose with the Pfizer and the Moderna, if they would get infected, with these variant strains, that's a possibility. They are not that sick, and that means the vaccine is working. I think when we have to be worried about the vaccine effectiveness is when people end up in the hospital who've been vaccinated, and we have not seen that. So the vaccines are safe and effective with those 2 doses. Thanks.
County Executive, it's Ashley Rowe here.
Ashley, if you could, I'll come to you in the second round. Okay, if you could, I'm trying to do give everyone equal 1 question, and then we'll come back for a second round. WIVB Channel 4, George Rickert.
Hi, Mark. I just covered a rally of some parents out front who want to get in school at 3 feet distance, and I know Dr. Gale a little while ago spelled out that that's a state decision, not a county decision. Mm-hmm. But my question revolves around the high transmission rate that you alluded to last Friday, saying that even if the state goes with this, Erie County at the moment is considered high transmission rate. How far into the high transmission rate category are we, and is there a chance that in the coming weeks we could come out of it?
The CDC's most recent guidance said that the high transmission rate, as it pertains to a community and for schools, and it's not schools, it's looking at the general community, is anything that would be 100 cases per 100,000 in a 7-day period, or 200 in a 14-day period. And as I talked about earlier, we're actually, let me go back on the chart here. Our actual rate is for the 7 days, most recently ending March 20th, is over 200 for a 7 day. So it's really kind of double where the CDC says it should be to be in a high transmission community. That's why we're waiting for New York State to issue its guidance. The CDC makes a recommendation. New York State Department of Health, New York State Department of Education issues the rules and guidelines for schools. I think it's funny, a few years ago, you remember, I came up with some recommendations with regards to cost savings for the potential merger of schools and school districts. And I got a lot of pushback from people associated with some of those school districts and elsewhere saying, stay in your lane, polling cars, you have nothing to do with schools. Now I've got people who are like, make a decision for us, polling cars, because the other people don't want to make the decision. I've talked to superintendents. They are in the same position. They will follow the guidelines that come from New York State. I've talked to an attorney that I know who does a lot of school legal work. And his response was, if the schools go before New York State, they're putting themselves at risk such that their insurance will no longer cover them in case there's an illness or, God forsaken, a death as a result of what happens in the school. So right now, Erie County as a whole is over 200 per 100,000 residents over a 7-day period, 217.8 to be exact. If you look at it on a community basis, so people are like, oh, you can't do a countywide basis. You got to look at it on a community basis. It's higher. It's much higher in some communities. And as I noted earlier, there is not a single zip code in Erie County that we analyzed, and this is only a partial list. I'm talking about the whole list. There's not a single zip code in Erie County that we analyzed that is below 100 over a 7-day period. So that is concerning. And it just goes to show that we've had this increase, as is noticeable here. We have had an increase, roughly a 1/3 increase in new cases over a 7-day period per 100,000 residents that would indicate to us that we're seeing continued growth. So, George, all I can say is the state sets the parameters. The school districts have to follow the state standards. If the state changes the parameters, that will be the parameter and the guidance for all school districts in Erie County. That's it. If the state says you can go to 3 feet, it will be 3 feet for all school districts that can safely do it. Last year, Erie County gave, I think, $15 million to schools combined to assist them to create a safer environment in schools. They could buy partitions, they could buy PPE. A lot of them bought partitions and other types of procedures to protect their students, or they could use it for virtual learning. And we were one of the only counties to do that because we want students to be in a learning environment that's best for them. We want them to be in classrooms, but they need to be in a classroom that's safe. We don't make the determination. We don't have sanitarians that go out and confirm whether a school has appropriate partitions for a 3 feet or a 6 feet. We just don't have the staff capable of doing it. The only thing that Erie County has ever done when it comes to schools is going in to ensure that the lunchrooms are following proper protocol, such if they make food on site, they get our Erie County Department of Health permit. We make certain that if they got chicken, it's not sitting on the table, and it's unfortunately getting bacteria. So those are the only things we've ever really been involved with schools. We've had lots of conversations with the school districts. They understand that they have to follow New York State guidelines. They've been receiving advice from their legal counsel that they need to follow New York State guidelines, or they're at risk of not having their insurance cover them in case of a major illness or death in school. And I would just note that we've been told, Dr. Burstein's been told, I've been told, that the New York State Department of Health is reviewing this, and we are expecting an answer soon. I thought it might come yesterday. It didn't come yesterday. Hopefully it'll come soon so everyone understands what the rules are for New York State. Spectrum News, Andy Young.
Hi, Mark. As more places like pharmacies, physicians' offices, things of that nature become eligible to vaccinate more people, given they have the supply, if they have the supply, is there still a need for the potential planning for a mass vaccination site like the convention center? Is that still in the works, or will the current sites, the pop-ups, the physicians, the pharmacies, the other Erie County sites and state sites kind of be able to handle that?
Well, if we continue on the trend that we're seeing with now New York State has a site at the Niagara Falls Conference Center. We, of course, have the site that's the FEMA New York State site at Delavan Grider. We have the 3 locations that are Erie County based that can handle 1,000 or so per day. If you have the pharmacies, the healthcare practices, and still hospitals receiving it, we're already talking about potential, once we have lots of vaccine, to do a mass vaccination drive-in site as it gets warmer. It's not warm enough to do that, and we don't have the vaccine to do that. So if we're getting closer to the warmer temperatures like we have today as being the regular temperature, it would really make no sense to do that in a location like the convention center if we could utilize a outdoor mass vaccination site where we could even get more people through quicker. We're just not at that point yet. We don't have the vaccine from New York State and the federal government to do that. And I would like to think that while we have a lot of sites in Erie County that are providing it, if we are, instead of getting as a community 10,000 doses a week, but we're getting 100,000 doses a week, we're going to need to have a mass vaccination center to do it. It's as simple as that. WBFO? Anybody on?
Hey, Mark, it's Tom Dinky from WBFO.
Hi, Tom.
I wanted to ask you about nursing homes. There's so much talk about nursing home reform right now, and state lawmakers are considering some pretty big changes to the industry. Back in 2017, you tried to implement some nursing home reform at the county level in regard to Ruthie's Law. It's obviously been hard to enforce that. Nursing homes have argued it's illegal, and some filed a lawsuit. I just want to ask, how do you look back at the Ruthie's Law experience now after what we've seen in nursing homes over the last year, in light of the problems that have become more evident during the pandemic? I mean, are you glad you guys have at least tried to do some reform in the past? Did it show you just how difficult it is to regulate this industry? Just your thoughts.
We are currently being sued by the conglomerate of nursing homes and the lobbying organization for them from New York State with regards to the enforcement of Ruthie's Law. We've had a number of nursing homes, generally those that are locally owned, that respond to our requests for data. We have ones that are not locally owned, for-profit entities from elsewhere that are not responding. And they're suing us to prevent the enforcement of the law. We should have the power to enforce this law. New York State should just, if they're going to make major nursing home changes after all the issues we've seen, they should give the local health departments the power to go in and confirm the safety of a facility. We should have the power to receive notices about serious cases that occur in facilities, including deaths. We attempted to do that in New York State, and we're being sued by nursing homes to prevent us from that information and enforcing the law. I really appreciate you bringing it up, Tom, because after everything we've seen in the last year, there are good nursing home operators and there are not so good nursing home operators. And the problem is if you put your loved one in the wrong nursing home, there's a much higher chance of them dying or suffering a serious illness or other type of malady, including injury from falling, in the lower rated nursing homes than the higher rated nursing homes. I believe the county should have the power to be able to go in there and check on conditions, as well as the ability to receive information with regards to serious incidents that occur among patients. And if you want any proof of it, the nursing home lobbies is suing us to prevent the law from taking effect. Why would they be suing us to prevent a law from taking effect that is there to protect their patients unless they really didn't care about the safety and care of their patients? It says a lot. WBEN, Mike Baggerman.
Hey, Mark, can you hear me okay?
I can. Go ahead, Michael.
So my question is regarding schools, kind of a follow-up from George's question a moment ago. I understand your positioning about how the county can't dictate policy, but there's going to be people out there who say, okay, well, what about Onondaga County? My question to you is there anybody from either New York State or is it the county attorney that's explicitly telling you that you can't dictate school policy similar to what we're seeing in Onondaga County?
We've had some, well, first off, I've heard from a couple of individuals, including associated with New York State Association of Counties and the attorney, that said Onondaga County is at risk. Every school district that follows the protocol is at risk for not following the public school guidelines. I've actually had an attorney saying they're waiting for an issue in a case there to sue the school district and the county. It's pretty clear the New York State Department of Health and New York State Education Department are the ones that handle the issues associated with schools. The funny thing is based on our emergency powers, I have the ability to shut them down. I do not have the ability to tell them how they should reopen. So if we make a determination that there's a high risk, like we did earlier in the year, when the school districts asked me to shut them down, we shut them down in early March or later March of 2020 when we started to see the explosion of cases. But if I reopen them, all they can do is go back to this old standard unless New York State has said something different. So New York State is in charge. New York State makes the determination. I know there are parents that aren't happy. They think we don't want them in school 5 days a week. We want them in school 5 days a week. It's not my decision. We don't have the ability nor the power to go into the schools and determine this is a safe environment, that is not a safe environment. And that's why New York State sets the guidelines for the school districts that the school districts then have to follow. I know not everyone's happy to hear that, but that's what it is. In Onondaga County, I understand what happened there, but everything I've heard from state officials, as well as New York State Association of Counties and council, is they don't have the power to do that, and the schools that are not following New York State guidelines are at risk if anything should happen there, such that their insurance would not cover them. I know not everyone's happy with that, but that is the truth. Buffalo News, Sandra Tan.
Hi, Mark. The number of new vaccine doses that Erie County has been getting for the last couple of weeks seems to have stagnated, and I'm just wondering if you've got an explanation for this, if you have any expectation that this is going to loosen up soon, and whether this might be an issue of some rural counties getting a greater number of vaccines. Is there like maybe new priorities being laid out by the state resulting in Erie County not getting as much?
I do know that Allegheny County and Cattaraugus County are getting some more, I believe, this week. Allegheny County, which over a 2-week period received 0. So I do know that Allegheny County was slated to receive more, and I believe Cattaraugus County. It wouldn't have made that much of a difference. It's not like there's, like I say, we dropped from 20,000 to 10,000 as a region. It's not like 10,000 doses are going to Allegheny or Cattaraugus County. I have heard from some county executives that they've seen a cut. I've heard from others that they've actually, and I talk about county executives, I'm talking about out of Western New York. And I've heard from others who said they've seen an increase after having a couple weeks of lower numbers. As best as I can tell, New York State has not really received more doses in the last few weeks. And they're juggling the doses around, giving it to areas that hadn't gotten as much in the last couple of weeks and reducing it to ours. I'm not thrilled about it, but it's not something I can control. It's not like I can pound my fist and magically more doses appear. I've been talking on the phone saying we have the ability to do more, we have the ability to do more, and I believe that's why we got 1,500 more doses that New York State will be providing us from the excess nursing home program. Basically, they were sitting at in a major pharmacy chain that was doing previously nursing home doses. They couldn't be used for anything else. They were not authorized to be used by their just traditional clients in the pharmacy. New York State is giving them to us, so that'll be another 1,500 doses. So we'll have a little less than 6,000 that we'll be able to do in the upcoming week, but that's still less than we had in the past, so it's disappointing. USA Today, Mark Longerial. Sorry if I messed up your name. Anybody there from USA Today? Nope. We will go then to anybody else I have not called on from a different media organization? If not, we'll start out with.
I have a question. I have a question.
Who is this?
This is Barb O'Brien at the Buffalo News.
Barb, I'll get back to you. Let me start from, I'll go with Ashley Rowe at Channel 7, because she had a question earlier. Ashley?
Sure, yeah.
Thanks, County Executive. You, about over a month ago, had said that the Buffalo Convention Center was in strong consideration and in the planning stages for opening a mass vaccination site by the end of March was your target. What's the status with that?
It's not happening. New York State has not authorized it. They have opened up a mass vaccination site at the Niagara Falls Conference Center, and as of last, it's probably not going to happen, and that's why we moved ahead with the Key Bank Center, which could be used as a mass vaccination center for more doses than we're currently giving. But right now, we don't have authorization, so it doesn't make sense to create a site that neither one has authorization, or number two, we don't have the vaccine to justify doing a site that can do 3,000 or more doses a day. And as I noted earlier, as we get into the warmer months, we're looking at doing outdoor mass vaccination sites where we could do 3,000 to 4,000 doses a day. But it doesn't make sense to do it when it potentially is still 30 degrees outside, notwithstanding the wonderful weather we've had. We do know it can snow in April and even on Mother's Day, but we want to think forward.
You were quite optimistic about that back in February. Are you disappointed that it's not been authorized?
even if it was authorized, we don't have the doses to justify it. We're expecting 5,000 doses for the upcoming, or 5,800 doses for the upcoming week to Erie County, first doses. At a mass vaccination site, it would be 3,000 or more per day. We'd only be able to open it up for 2 days. It doesn't make sense. We can distribute 6,000 doses at our other sites easily, no problem. At this point, if the state doesn't want to approve it, we move on. And that's what we've done. We've moved forward. That's why when I first talked about the mass vaccination site at the convention center, we weren't talking about the Key Bank Center as a location. We have the Key Bank Center as a location now. And if we have to ramp up the delivery of doses there, we can. And if we're talking about at the end of April, early May, opening up an outdoor mass vaccination site, we can do that as well. Just the convention center does not seem to be a location that will be used. And if there's one thing I learned when it deals with COVID-19, you adjust and move on. Why don't we go to Barb O'Brien now from the Buffalo News?
Thank you. I have a question on the increase in cases in schools, the student to student. Is it from kids hanging out together outside school, or can you tie it to the classroom? Does that include, is it the sports teams? And how many or what percentage can be tied to student transmission in the classroom? Does it matter if they were wearing masks or not?
I believe, I'll turn it over to Dr. Burstein, but we do have some pretty good evidence that there was in-class transmission, especially among what was a kindergartner class.
Mm-hmm.
Yeah, thank you. Yeah, unfortunately, we have seen more cases that are highly suspicious of school transmission. There were multiple students in a classroom that became infected in a very short period of time. A particular school had the children were seated. It's a kindergarten class. They were seated just 3 feet apart. Even though they were wearing masks, we did have strong evidence that there was transmission, and so they ended up closing the classroom. So we do see unfortunately in-person transmission within this classrooms. I mean, we also see transmission in schools. Kids are getting infected, say, from participating in sports teams. We see a lot of that. Also with siblings, people infected in the household, and they're bringing it into the school. So there are multiple sources of transmission, and that's why we have to be very aggressive with our case finding, our case investigation and isolation and quarantine, and that's why although the schools may be able to go to 3 feet social distancing, if that happens, our definition of close contact does not change. And so there will be more students and staff in the school that will meet the definition of a close contact because they'll be within 6 feet of the case. In addition, 3 feet is pretty close to each other, and so there are, in those classrooms where there are, the students are 3 feet separated, there are a lot of kids in the classroom, like, pre-COVID times, like, 20, 25 kids in a classroom. That's a pretty crowded classroom, and so the transmission dynamics in that crowded situation are different than in a much more sparsely populated classroom, so we have to take that into account too. But however, again, whenever New York State sets as the school guidelines, we will follow. But again, the New York State Health Department guidelines for close contacts and isolation and quarantine are not changing. Thanks.
Thank you.
Okay, we generally do an hour. It's been an hour. I would just note, is there any other questions? Anybody else have another question? If not, thank you to the media for joining us today. It has been 1 hour, so we thank all for your participation. I want to thank Kendra Schmidt from Deaf Access Services for her continual American Sign Language provision for us. Thank you, Kendra, for the great work that you do. Thank you to Dr. Burstein, her team in the Erie County Department of Health that has worked very hard. It's basically been a year since, of course, we had not only our first case, but I think it's almost 1 year to the day tomorrow. We've had our first death as a result of COVID-19 in Erie County. And the Department of Health staff, the Department of Homeland Security Emergency Services, the Department of Public Works, the Department of Purchasing, the Department of Senior Services. There's so many departments that have been actively involved in this process since day one, and I just want to thank them for all their good work. It's been a long year. We're not out of the woods yet, and hopefully if we continue to do our best by masking up and getting vaccinated, we will be out of this, just not yet. So take care, be safe and well all. Thank you.
Secretary Fudge was elected the first female and first African-American mayor of Warrensville Heights, Ohio, a position she held for 2 terms. As mayor of Warrensville Heights, she adopted one of the first vacant and abandoned property ordinances in the state. Additionally, she brought